Hi guys, I'm Dr. Omkar Warang here, consultant dermatologist and director of trichology at the Hair and Shape Clinic, Malad, Mumbai. So today, let's talk about hair loss or androgenetic alopecia, which is the most common condition that we see in our OPD on a daily basis. So what is that and how does it occur? Male pattern baldness is the other name for it, which can also be seen in females, known as female pattern baldness. Now, why does it occur? It's because of mainly hormones, stress, your diet and lifestyle changes. So what are the treatment options available to treat it? Number one are your medicines. Number two is regenerative medicine. Have you heard the terms PRP, GFC, exosomes? Right. So let's delve into all these terms and talk about them in detail. What is PRP? PRP stands for platelet-rich plasma, wherein we withdraw your blood, it's put to spin, and what do we spin in it? The platelets, right? They are rich in growth factors, which are then injected onto your scalp skinning. Think of it like as an energy juice for your scalp. It stimulates the lazy hair follicles which are present and boosts the hair growth. Now, let's talk about GFC, which stands for Growth Factor Concentrate. Consider it to be PRP's upgraded cousin. Here also, we utilize your blood, but it is more concentrated form of PRP, which is rich much more in growth factors. And the same thing is injected onto your scalp to give you a much better results, faster recovery and less inflammation. And guys, the new kid on the block is exosomes. What are they and how do they function? Exosomes are messengers or tiny vesicles that are present in the body that help in communication from one cell to the other. In short, when injected onto your scalp, they stimulate the hair follicles to grow hair over there. So how do they work? They contain proteins, genetic growth factors which help stimulate the hair follicles. Now they are available either plant-based, animal-based or human-derived exosomes. So we do not require blood for that. We directly inject onto your scalp and help in the growth of hair. So the exosomes are the latest innovation in non-invasive or non-surgical hair restoration. So PRP, GFC, exosomes, for this you need to get evaluated and then choose the right treatment for your hair loss. Hope this helps and please follow us for more details. Thank you.